vaccines can prevent infectious diseases that pose potential harms, such as lifelong complications or even death to your children. My name is Jessica Curry, and I am a PAA at Salina Pediatric Care.
As a child ages, what vaccinations do you recommend?
So vaccines start at birth. Shortly after birth, infants receive a hepatitis B vaccine while they're still in the newborn nursery. And then we vaccinate again at age 2 months, 4 months, and 6 months. And there's a variety of vaccines that are given basically just in booster doses at those appointments. That includes against diseases like diphtheria, tetanus, whooping cough, polio, pneumococcal infections, Haemophilus influenza B, hepatitis B again, and rotavirus. Then we do get further vaccinations at age 1, and that is the MMR vaccine, the chickenpox vaccine, and the hepatitis A vaccine. And again, a couple booster doses at 15 months old, 18 months old. Then before kindergarten, usually at age 4, they get another booster of the MMR, chickenpox, DTaP, and polio vaccines. And then at middle school age, at age 11, we recommend a tetanus booster, meningitis vaccine, and the HPV vaccine. And lastly, at age 16, they get a couple meningitis booster doses again.
Okay. For so many of these diseases that we're talking about that the children are vaccinated for, the disease itself is almost completely eradicated. So what do you say to the parent who says, well, I never see that disease. This disease never comes up. Does my child really need to be vaccinated?
Sure, yeah. And that's, the beauty of vaccines is we have been able to control a lot of these diseases to an immense extent. But a lot of those diseases do still exist in very prevalent amounts in our communities. Examples of those would be like influenza, pneumococcal infections, varicella. We still have chickenpox. We still have whooping cough. So these illnesses are things that are still very prevalent in our community and still pose a great risk to our children. Other things are less prevalent. For example, things like measles, mumps, Haemophilus influenza B. A lot of people have not even heard of that. But those things do still exist in low levels, but in the United States. And we've seen, recently even with the current measles outbreak, it's the second largest measles outbreak that we have seen since the year 2000, when measles was virtually eliminated from the United States. Unfortunately, since that time, vaccine rates have fallen in our country, and we're seeing the effects of that in real time.
Well, thank you so much for some great information, and thank you for watching. For more information, please visit salinapediatriccare.com and follow them on Facebook.